Hi, everyone. Welcome back to part 4 of our 2020 Comeback Plan. I'm sure a lot of you have been here through the whole program. Welcome. Some of you may have joined us here for this last one. This is your first webinar, or maybe you watched the recordings of the other ones and you're joining us live for the first time. We are thrilled to have you all here for the 2020 Practice Comeback Plan 4th webinar, where we are talking about the key steps to succeed during and after this crisis. Everyone is dealing with their own unique circumstances right now, and we're doing our best to provide some great information and resources to help you. My name is Leah Chatham, and I'm the Director of Content Marketing here at Solution Reach. I have been working in some kind of practice management, patient engagement, education for providers and staff for more than 15 years. I also have about 5 years of working as the person responsible for marketing, patient communication, patient engagement for a small integrated health system. So hopefully I've got enough experience on both sides to provide some good insights. And I am joined today by that handsome man with the beard, Addison Reed. He's our customer education manager here at Solution Reach. He does a lot of the content that you find in our community, the knowledge-based articles and videos and all kinds of customer education. So he's really one of our great experts on all the ways you can use the Solution Reach platform and best practices around that. I'm really excited for both of us to spend the next hour talking to you guys. I do want to mention a couple things before we get started. The first one is please enter your questions as we're going along, and we'll do our best to answer them. And then if we've got a little bit of time left at the end for some open Q&A, we'll answer more questions there. Also, I would encourage anyone who's on here to connect up with us on social media. It's just a good way to sort of stay up on the latest, greatest opportunities for education, news, insights, especially during this time when things are changing so fast, whether that's related to the industry or related to new solutions and resources coming from Solution Reach. If, like I said, we do want your questions, but if you have questions that are more support related, we would encourage you to go to community.solutionreach.com, click on My Support, and chat with someone to get those answered, or email community@solutionreach.com. Also, you might consider just putting your query into the search bar there in the community. You might actually find there are some resources there that can answer your questions. So check that out if you're having support related stuff instead of putting that stuff in the questions here. A couple common questions. We will be sending out the slides and the recording afterwards, so you guys will get that. And also, if you are having any problems with your sound, if it gets choppy at any time, I would encourage you, if you're listening on your computer, to go up to the audio option on your toolbar and switch from computer audio to phone audio and dial in. That usually resolves any issues you might be having. So today's agenda, we are going to be talking about some of the things you need to do as you really get fully reopened and pushed into kind of growth and thriving mode in the second half of this year. Mostly we're going to be talking about developing some really structured plans around how to do that and what you will do if there is another COVID resurgence in the fall. We'll be talking about some of the tools that are available to help you. We'll be talking about some best practices. And then, of course, we will have some opportunity for Q&A at the end in addition to answering questions as we go. So one of the big things I think we need to really touch on here is that you do need to have some kind of contingency plan, and you should be making that plan now. We are hearing from a lot of experts that we are likely to see a resurgence, a second or even third wave of COVID-19, given that there is not a vaccine, and that states are kind of individually controlling how they reopen, and some may be doing a little bit better at controlling that than others, as well as, of course, individuals. Some are doing a better job than others in terms of, staying home and sheltering in place and wearing masks. So we're seeing a very erratic kind of spread here, right? We may see areas that have been okay turn into hotspots and all those kinds of things. So it's likely that we'll see another wave in September through November. And again, areas that maybe weren't hit as hard initially might be hit harder the next time. And that's likely to be more in the interior versus the coast, where we've already seen some fairly substantial spread of COVID. And it could be more challenging because we may be dealing both with COVID and with the flu at the same time. So really having some kind of plan for how you will quickly navigate back to the use of telehealth and communicating with your patients about how to get care and all those kinds of things. We're learning a lot right now. So let's use what we've been learning to help us prepare for another round, if that in fact is what ends up coming. So I'm going to hand it over to Addison. We'll talk a little bit about developing that plan for the next 12 to 18 months. Addison, why don't you jump in and kind of tackle that, and we'll kind of do some back and forth and hopefully answer your questions as we go.
I am rearing to jump in. I've been so excited to cover the content in this one. I know a lot of you out there might be thinking, Addison, you're always rearing to go. You're always so excited. You're always amped up. And I love this stuff. This is what I live and breathe. So we've talked a lot about this concept in previous sessions of this webinar series, flexibility, both on the side of being flexible with your patients or flexible with your staff, flexible in a lot of different ways. So with this thing in mind of developing a written plan, for the next 12 to 18 months, again, flexibility is key because, like Leah said just a second ago, things may change very quickly. What if you get sick or your providers get sick or other staff members? What if staff members decide to move on? That's a normal thing to expect. What if your geographic location is hit especially hard? Again, like Leah mentioned, potentially those more inland areas are predicted to be hit a little harder. But this is nice because you can develop these backup options, wherever you think they need to exist. The way I like to think about this with creating a plan is think about our day-to-day at the practice or at the clinic. We all know that inevitably we're going to have a patient that's going to cancel or no-show on us, right? That's an inevitability. So think of it with that same frame of mind. You can imagine that maybe it's not inevitable that we may have a second wave of COVID, but a lot of these experts, they're predicting that is a very high likelihood. So with that in mind, we can plan on that and look at some of the things that we've learned right now, going through this experience right now. So this is why we want to focus on start now. We're trying to get as much of this content out in front of you before many of you are beginning to reopen, and because it's going to take some time. And this is a great time to take advantage of that, because if you're seeing a limited number of patients right now, chances are you have a little bit more of that free time to focus on some of these different efforts of getting your practice ready to reopen and then ready to, down the road, really thrive and really be successful. So look at your initial response to how you initially reacted to this current experience. What weaknesses do you see looking back, right? That hindsight is 2020. So what are the weaknesses that you can identify from your viewpoint right now? Where did you falter? Where did you realize we didn't have a plan in place? So we really were hit hard in this one area, or hey, we didn't have enough PPE on hand, so we really suffered there. This is a great time to just really reflect and look at the experience that you currently are in or have gone through recently. But also you want to collect as much feedback as you can from both your staff and from your patients, whether it's creating some sort of a digital survey that you're sending out, or calling out, to collect that, or texting out. We've mentioned that as a very popular method that patients prefer to be contacted through. So here's an example of a simple survey that you can create. This is a direct survey in our platform, but you can go in and look at some of the different questions that you think would be valuable to have the answers to. So some things like, how well did we communicate with you about, our availability or safety precautions, or the check-in process if you happen to change it. Ask the patients, or even the staff, what are some ways that this virus may impact you personally or has impacted you personally? What are your recommendations or not your recommendations, but how do we communicate, recommendations on ways you can stay safe and healthy? And then open it up. What are additional questions or concerns you have about how we responded? in this instance. Is there anything else that we could have done better or can continue to do to help you stay informed? Because again, I think, Leah, we've probably hit this enough times that patients are looking to providers as, the source of knowledge, right?
Yeah, absolutely. And I think it's super important to remember that, providers are one of the few people who are in a position to communicate out directly to people. There's only a limited kind of number of people who can communicate in that way. Obviously, the government cannot communicate out to people in the same way at the same level. Even other organizations may have restrictions on who they can communicate with and how often and how and all that kind of stuff. Whereas you, as a healthcare provider, have more flexibility, more options for texting and emailing, health related information to people. So you are truly one of the best, most reliable sources and most able to communicate out to patients, and just critically important,
Yeah.
moving forward.
Yeah, no, that's you're exactly right. And I know that with that example we talked about, asking those questions to your patients, but again, I want to stress this is a fantastic time to talk to your staff. Have them be totally open and honest, because if there's a good time to grow it and change and improve, this is it, right? I've communicated this to Leah and other members of our team. This mindset of that, right now with many of our offices kind of offering only limited services, it's really leveled the playing field for you and your competitors, in your same areas. It's kind of put everyone, on the same level. And so as everyone goes and begins to reopen again, this is a chance to really take any improvements to heart and actually make changes that are going to make a huge difference, not just for the way that you do business and how you treat patients, but for your patients as well. So some of these common challenges that you may want to consider as you're developing this plan are supply shortages. What were you short on, or what are you getting short on now? We had a ton of people reach out to us and say, hey, we're running low on gloves or running low on other supplies. Solution, what do you recommend? And Leah, I'd love for you to wait on this, but that's not really our area. So we've been trying to help out where we can. But it's a little bit difficult for us to respond to that and to answer those questions, right?
Yeah, I mean, I think we've been having to kind of send people to other sources. And the same thing kind of happened this morning, actually, in another webinar where we were talking about telehealth, and people were asking some questions, that really are things that are very state specific or very payer specific. And unfortunately, there are some cases where really you're going to have to go somewhere else to get that information. In this case, I would say kind of your specialty societies, local health departments, local state health departments, things like that, in terms of looking for ways to get the resources that you need. I will tell you a very quick funny story. I had to run my daughter into the doctor to get checked out for something, and I overheard the doctor. I'm currently in the Bay Area, obviously an area that's been, locked down for a long time, and that has, seen a large number of cases. And I heard the doctor in the other room saying that a contact he had at Salesforce actually said that Salesforce had managed to get a huge amount of PPE, and they were giving out some of it to doctors, and he was able to get some. So there are some unusual ways, depending on where you are and what other resources, you might check with other businesses, especially if there are large businesses in your area who may have tried, especially if they are businesses that are trying to keep some people on site for various reasons. You might check to see if they've found a way to get PPE and whether or not they can share some of that. But I think people are getting innovative. But I would strongly recommend looking to specialty societies, looking to state health resources to see how they can help you. And then, secondarily, maybe look at whether or not there are other organizations in your area that might have been working on getting some of those resources too and might be willing to share.
Those are great resources and great suggestions. You made me think back to, I think I shared a little bit about this in our last webinar series, but in my time as an office manager, we went through one particular instance that stands out in my mind where we ran out of masks. our supplier didn't happen. There was a problem on that end, and we didn't get things in time. We ran out of masks, and we thought, well, we have a full day booked, and supposedly the tracking number is showing the supply is going to arrive tomorrow. So we got to get, just get through today. So we decided to strengthen our relationships with the practices that we would refer out to. We went and talked to some of these specialists. We explained the situation. We said, could you spare just a box of masks? We love referring our patients to you. You see, less volume of patients than we do. Is there any chance you'd be willing to just spare a box so that we can get through today? We'll make it up to you, and it was a little embarrassing on our end, right? It felt a little embarrassing, but in the end, it really strengthened the relationships with those providers that we would refer to, and it was kind of an outcome that I didn't expect, but it actually ended up being a really great experience. So yeah, look out for some of those potentially unconventional ways to get those supplies that you may need. Lack of remote care. This is a big one that I think many people are, it's being brought to the forefront of their minds. What telehealth options do you have, and how can you promote them moving forward? Some offices out there, some who have said, hey, we understand the current situation. We realize we need to change a little bit, just to continue to serve our patients and provide treatment options and health options for them. So we need to, take this as a moment to look into telehealth and look at what's available. And some out there have said, no, we're going to kind of stick to our guns and stay with the old way we've always done things, and they're struggling a little bit right now. Like we've mentioned in previous webinars, this is a great time to get rid of that mindset of this is how we've always done things, because it may not be sufficient for you anymore. Paper-centric practices. I had a good friend of mine who's an office manager. I chatted with him just the other day, and he said, Addison, we got hit in an unexpected way. We ran out of paper at our practice, and we were kind of dead in the water because we couldn't print out statements, or we couldn't print out treatment options for patients, and we didn't know what to do. So we had to pivot very quickly and change a little bit of the way that we provided that information to our patients. So even some things that can help, reduce the amount of, clipboards and pens and even paper that need to be used at your practice. That's another fantastic challenge to take into consideration. Because if those places are closed, you can't get those basic supplies. You don't want to have that shut down your office. Poor communication with patients. Again, this you can rely on a survey that you're sending out, or information or data you're gathering through other means from your patients of how well did we do with communicating with them. Did the patients feel well informed? Did they, did they feel like we weren't sending out messages frequently enough to let them know what was going on? How was the response rate of patients? Were you being really good about sending out messages at a pretty regular cadence, but the engagement with those messages was low? These are great things to consider so that you can understand the things you may need to fine tune and tweak should something like this happen again. I know in this next slide we kind of jump back to that consideration about supply shortages. So use those regular resources. There are some websites that have been recommended from some of our own customers. Dentira is one that's been very popular. But again, like Leah said, be creative, whether it's the health department or local stores, or even Amazon potentially, or other reusable supplies provided by other means. These are you may need to get a little unconventional should a situation like this arise again. And some of you may already have had to get a little unconventional, and you've been able to succeed because of your ingenuity.
Whew. Yeah, and I would just add, so we've had, I know, we're still having people saying, like, how are we going to get this PPE, or how do I know I'm interpreting kind of the instructions correctly and things like that. So I would definitely look to the ADA. They have been great at publishing information and guidelines and recommendations for dental practices of all kinds. Again, definitely look towards your, state and local health resources. We are hearing from some people, hey, we're in a really hard hit area, and we're having to spend a lot of money on PPE, and it's getting expensive. How are we going to manage that? So do remember that part of the stimulus is about helping to offset costs for resources. I would recommend looking into whether or not there is any support or money available to help you with the cost for PPE, for testing, for all of those things. The other thing is, someone said, I may be misinterpreting kind of the rules here around some of this stuff. Am I going to have to charge patients for expensive PPE? So this is not a substitute for good legal advice or advice from your health department. But my understanding is that no one is asking regular people to wear like N95 masks. What they're asking people to do is wear some pretty basic face coverings. And so you should not be looking at having to provide all your patients with like N95 masks or something like that. And so, you can kind of look to those, again, the ADA, other, specialty groups, and things like that, for help and guidance around what you should be asking patients to do. Somebody just asked me if I was talking about the Paycheck Protection Program, and actually I am not talking about the Paycheck Protection Program. So a portion of the funds from the stimulus, right? The stimulus is initial stimulus is $2 billion, or $200 billion. There's a second stimulus program that's like another 300. A portion of that is the Paycheck Protection Program. A portion of that is actually healthcare testing and supplies. That's a separate thing. So depending on your organization, whether or not you're part of an ACO or you have some other connection that allows you to access some of those supplies, if you partner with your local hospitals or health systems, you may also just check with them about whether or not they're able to support any local groups. There is money that is designated for testing and supplies for local health departments, community health centers, rural health clinics, hospitals, health systems, et cetera. So that's a different chunk of money within the stimulus program. And I don't have the exact details on how it's being distributed, except to say that I know some of it has already been distributed to hospitals, health systems, community health centers, et cetera, and you may be able to work with them to help you get some additional supplies. Anyway, okay, so there hopefully are some resources to help you with that. No, I don't think you should pass on the cost for N95 masks to your patients, or that you need to provide N95 masks to your patients. Just to clarify that for the people who were asking. Okay, next, Addison, I'll let you take this, just talking a little bit about the ongoing use of telehealth.
Yes, telehealth is obviously extremely popular right now. A very, very popular word and popular term has come up. And again, before we dive into this, take a step back, take a breath. The big picture with this, all the things that we're talking about today is developing that long-term plan. This is what you can, if everything just kind of goes to pot, this is that plan. If you have that in place, this is what you can rely on, and this is what you can follow. You don't just have to react. You can say, no, we're not going to react. We're going to rely on the plan and the steps that we've outlined. So the mindset here is to think about all the different things that can shut down your practice potentially. And telehealth is a very, very big one, as some of you may be seeing right now. If you haven't already implemented telehealth, we highly, highly recommend you do it now. Take the time to research and learn and understand the changes that may need to take place in your practice and any processes that may need to change so that you can provide telehealth options. Survey patients who are using telehealth, and ask them for feedback and ask them for ways that you may need to make it, or adjustments you may need to make so that you can make that experience even better. There's a lot of us are experiencing telehealth for the first time, both as patients as well as providing it to patients. So, this is a fantastic time to learn and grow and to be understanding, and again, be flexible. You may have patients that are still a little apprehensive to try it out. Do what you can to encourage them, and more so, help educate them as to the ways that it can benefit them and help improve their health and their experience and keep them safe during this time. But again, take the time that you need to monitor any ongoing changes for coverage or any changes related to HIPAA so that you can make sure that you're staying compliant. This is a fantastic time to just learn, to soak everything up like a sponge, learn as much as you can, and again, be flexible to changes that may happen. Because while some things are a little bit more relaxed right now, they may be less relaxed as we move out of this period and everyone, kind of goes back to work, if you will. So with that, we have SR Telehealth. I'm going to let Leah, if you don't mind, I want to let you jump in here and talk a little bit about this.
Yeah. Yeah, I'm happy to. So we did do, for those of you who've been on these webinars in the past, that in the last one, we announced SR Telehealth and that we had done a survey of our customers to kind of gather some information about what people were doing and what they needed. And what we found was there were a lot of people who were still in need of some kind of easy-to-use telehealth solution. And so we very quickly worked hard to get something pulled together. We are constantly adding new features, but we have been able to launch kind of the basic version of this for people who need it. It is a solution that's launched through SR Conversations, which is our two-way text messaging tool. It can be launched on demand during a quick kind of text back and forth check-in type interaction. You can also pre-schedule these and then hop on and text them the link and then launch it through text that way. It is secure, it is HIPAA compliant, it is high resolution, and currently it's free until July 31st. So knowing that a lot of people were needing a solution like this, I'm going to quickly push out a poll. If you'd like somebody to follow up with you about this, just let us know in the poll, and we will have somebody reach out and let you, give you some more information, walk you through how it works and what it looks like. We'll let that run for about 30 to 45 seconds. If for some reason we've had a few people who say they're not able to click on the polls. If that's the case, we've also added a question to the survey at the end of the webinar, and you can say, yes, have somebody from Solution Reach follow up with me in the survey, and you can do it that way as well. So if you're not able to do this, I'm going to give people a couple more seconds. We've had some questions come in from people about, aren't there some states where you can't do telehealth for dental? As I understand it, yes, there are still a few states that do not allow that. Really the best thing is there is an organization, and gosh, for some reason it's just escaping my brain right now. There's a national organization that monitors all the rules for telehealth for all the states. And I'm sure you can find it if you do a search, and I apologize that I'm blanking on the name right now. But essentially, they aggregate all the information for all the states and what's allowed and what's available for telehealth for all the states, so that you can look that up that way. A couple of people have asked specifically about Texas. I do understand that in Texas, telehealth for dental is not currently allowed, but things are changing quickly, so you never know what will happen. It's good to look that site up and get that information, and I'll try to look it up really quick while we're on here if I can, and post it if I find it. Okay, I'm going to close that. So if you said yes, again, we will have somebody follow up with you about that SR telehealth solution. Somebody's asking if this is strictly video. This is video. So you can do text-based check-ins using SR Conversations, and then yes, you can also do video like this. And of course, another option for telehealth is phone. So you can do phone, obviously, using any phone device, but this allows you to do the text-based check-ins and then launch live video. Okay, so moving on to the next one, I'm going to hand this back to you, Addison, just to talk about some of the other ways you can kind of reduce that paper usage in your practice.
Absolutely. Yeah, this is a theme I'm very, very passionate about, in particular because of how much it affected my life when I worked in a practice. Paper was everywhere. It was all over the place, just stacks and stacks and stacks of it. And we got to the point that we were handing out so much paper, our patient said, "Do you have a recycle bin?" So we took that as a note and a bit of a hint, a strong hint that we should probably change the way that we were doing things. So some of the ways that you can help to reduce, the use of paper and that person-to-person contact, right? Those clipboards and pens that need to be touched and used by patients and yourselves sometimes. There's a few different options you can do. We've talked really heavily about the digital check-in process. We have a solution for that called SR Intake that allows you to send those intake forms to your patients directly to their device. And, one of the big reasons one of the big benefits of that is that it can be used as a pre-screening tool, right? You can have a questionnaire specific to COVID-19 symptoms in there, but also it reduces the amount of time that patients need to spend sitting in the waiting room filling out paperwork. If they can fill that information out before they even arrive at the practice, I mean, the way that I'm thinking about it is the most ideal situation would be I get sent, I'm a patient, I get sent my intake information, I fill it out prior to showing up for my appointment, I arrive at the practice, and since I'm ready to go, I'm ready to be seen, and assuming the office is running on schedule, I don't even have to sit down in the waiting room. I can walk in and they kind of receive me right there and say, hey, Mr. Reed, we're actually ready for your appointment. Why don't you come on back to the treatment room? That would be my ideal situation as a patient, because that streamlines the process for me, right? If I'm going in to be seen by my dentist or my general practitioner, I'm usually taking time off of work. So if my provider is trying to be really time efficient, that really speaks to me from a patient standpoint. And if you are, if you're looking for ways to increase the efficiency from the side of being a provider or a practice or a clinic, this means you can potentially see even more patients during the day because you're spending less time waiting for people to fill things out in the waiting room. Another way is to introduce scheduling via an online method. So if you're using SR Schedule already, kudos to you. If you are using a different method to provide this option to your patients, that's fantastic. I know I shared this example, I can't remember if it was last week or 2 weeks ago, but when I go to fill up my car with gas, I hate having to park my car and walk in, pay the attendant, and come back out. I love being able to just drive up to the pump, pay right there, fill my car up, and go. That's so much more convenient for me as a customer. And so why shouldn't we introduce that type of convenience into the healthcare space? It just makes sense to me. So if you have an online scheduling tool that you're an option that you're providing to patients, that's fantastic. And again, that makes more convenience for your patients and allows them to request those appointments. Now, a common question, just to real quickly address that we get whenever we talk about SR Schedule is, well, I don't want my patients to just be able to fill an appointment out in my appointment book wherever they want. And that's not how it works. Patients request an appointment. They're able to see openings that you allow them to see, and you're the final say. You get to say, yes, we will confirm this appointment request, or if it doesn't work for you, or if you happened to schedule somebody else in the time that they are requesting, you can say, hey, that time actually doesn't work for us anymore, but here are 2 or 3 other times that would work. So you still have final say as to where your patients end up in your appointment book or on your schedule. Another option regarding payments. Oh, I can't. Leah, maybe you are feeling the same way. I can't think of how many statements I've sent out and how many envelopes I've addressed mailing out statements. And
not just that, but even changing statement services. I mean, I know people often will say, like, when we talk about this and say, oh, it's so expensive and time consuming and all these things, to send statements yourself. And people will say, oh, we use the service. Well, I remember trying to make updates to changes in our information, like address changes or phone number changes, or changing the details about when you could do something like a 10% discount on self-pay amounts or whatever it was. The process of changing that with your statement service was like pulling teeth. Pun intended.
Pun intended. Yeah, you're absolutely right. That was whenever it was statement day at our practice, it was just more of a, oh man, okay, make sure I have an extra big cup of soda nearby to get me through that process. So you allow your patients to pay online. This is, again, it's going to increase convenience. I mean, think about the way that we interact with places like Amazon, right? We're able to get on, we're able to order things right from our phones and pay for them right there. It's extremely convenient. We're to the point where we don't have to break out a computer. We can do it right from our phones, right from an app. So if we give patients a similar experience in the healthcare space, which is really, it's what they want. It's what they're experiencing in so many different other areas. So why shouldn't it, again, carry over into healthcare? So, we have SR Pay, which you're able to send out these payment requests right through conversations. But if you're using a different method, that's okay too. The real big takeaway here is make this a convenient process for your patients. because as you're making it convenient for them, this means that it's a high likelihood that they're more likely to interact with these messages and therefore more likely to pay you on time, or pay you when you request a payment from them. So this can help with your accounts receivable and any collection processes that you may have in place.
Hey, Addison,
Yeah.
couple things. These are similar questions to things we've gotten before. Really quick, the first one is specifically about SR intake, and someone asking, can you send those SR intake, links out via text and email?
Right. Yes, they can. They can be sent via text and email. Great question.
Yeah. And then another one, then this is more of a general question about kind of online, bill pay solutions. But, people, I think when we talk about this, people often think of like later down the road, patient due amounts for whenever. And people ask us all the time, like, oh, can we collect at the time of service if we're doing like telehealth and stuff like that? And I think we just want to reiterate to people, yes, right? you can use SR Pay or whatever bill pay tool you're using. In fact, you should be, right? The best practices still apply.
Yep. No, you're absolutely right. There's, whenever you can, I highly recommend that you take advantage of opportunities to collect at the time of service. It's, it from a patient standpoint, I think of myself as a patient, right? We all are, but I think, man, I actually prefer to pay at that time rather than just to kick the can down the road, because then I don't know what's going on in 3 weeks or 4 weeks or whenever that EOB comes back. I don't know what situation I'm going to be in, but I love being able to say, you know what, I can pay this amount right now. I know I know the situation I'm in, but again, it'll help with that collection process and the revenue that you can bring in at the practice. Really good questions.
Yeah, and definitely in this telehealth world, right? If you're doing telehealth appointments or something like that, and there is a patient due portion, being able to collect that now, do that virtually without having to, do any back and forth of cards or, mailings or whatever, that's great in the COVID world. The more you can do without having anybody touch anything, the better.
Yes, yeah. Touchless experience. You're absolutely right. The car washes do touchless, right? So why can't we do it in healthcare?
I'm going to hand it back over to you, Addison, to talk a little bit more about, some of this communication stuff.
Yeah. So again, we've kind of touched on this previously on a previous slide about, sending out a survey or otherwise gathering feedback from your patients and from your staff. Ask them what you can be doing better to communicate, right? If Leah, you've pointed this out on a few different webinars that we, whenever we are sending out the webinar information after the webinar is over, we see a lot of auto replies from our customers saying, hey, we're out of the office until, further notice, and that's kind of it. But they don't provide any way, that lets the patient know how to communicate with them. So, what does the patient do? I mean, if I were a patient in that situation, I had no clue how to contact my provider, I don't know, maybe I go to a different provider. I talk to my friend and they say, hey, my provider, you can text them or call them. And I think, well, great, I don't know how to communicate with my own provider, so I might switch providers. So this is, again, a really crucial moment to think of and look at the way you're communicating with your patients and how you're informing them to communicate with you. So with two-way text, again, this is incredibly important. It's fantastic if we have a method to send messages out to patients, but we want a way for them to initiate the conversation as well, and to continue that conversation via text instead of having to pick up the phone, because phone calls, I don't know about you, Leah, I can only handle one phone call at a time, but texts, I can usually handle a few different text message threads at once, without going a little too crazy. I can keep those conversations kind of straight and know who I'm talking to.
I think I've got 3 text conversations in the background on my phone as we speak.
There you go. Yeah, perfect example. But again, collect that contact information and preferences as to how patients want to communicate. We saw in a previous webinar in this series, the different types of patients who want to communicate via text, and that spanned all the different generations that are out there. But overall, if you do have patients that have preferences, communicate with them through their preferred method. For some, it's going to be text. For some, it may still be phone or it may be email. Communicate with them through their preferred method, but make sure you're communicating with them. Some of those key things that you may want to share, again, is let patients know that maybe you won't be able to see them in person if there is this, second wave of COVID. But again, if you have a plan in place, you're going to have a method for them to communicate with you. Maybe it's telehealth, right? Or maybe it's some other method that they can communicate with you. Maybe you decide to get really, really, inventive with it and say, you know what, we're going to really make sure that we are very present on our social media page, so that you can reach out to us and we can provide you with any updates you might need. Go look at in those spaces. But again, encourage as much of that preventative care now as you can. This is, preventative care, obviously it helps to prevent the majority of treatment that's needed. If we could just convince patients to get in more frequently for that preventative care, that would help reduce so much concern and so much cost on the patient side down the road. Man, I'm getting so excited about this. I want to get up and start pacing in my, in this space that I'm in, Leah. So, oh man, seriously, this is the stuff that I just eat up. I love it. So we're going to kind of breeze through this one a little bit, because we've talked about it in a few different ways and on a few different slides here. But understand and address the needs of your staff. We have staff that are in all sorts of different situations, similar situations to our patients. Maybe they're single parents. Maybe they are a caregiver to someone who's elderly or someone else who's at high risk. Maybe they're high risk themselves. And if someone's high risk, we've talked about this in previous sessions as well. If someone's high risk, look for ways to accommodate them and allow them to continue to work for your practice. If you have someone who's a part of your clinical team who's high risk, maybe this is a fantastic time to cross-train them on some of the things that the administrative team does, because then that allows that person to work from home from a safe environment, and continue to help the practice grow and continue to help the practice as a whole, right? We're all part of that family in a practice. Sometimes we spend more time with our coworkers at the practice than we do with our own families. That's how it was for me for quite a while. So again, work on those families, those teams that you have. If you have teams that are in-house, like the administrative team, how much of that can work from home? How many of those members can work from home? If you have teams that need to work on site, right, your clinical teams and so on, maybe divide them into shifts and have certain staff members kind of work shifts throughout the day, so that you reduce the potential for exposure across your entire staff. And by doing that, you can say, hey, let's just contain it. If something happens, let's contain it to a small group of people on the staff that are affected. It helps you to be a little more agile, and it'll help put your staff at ease. That's the thing is, again, in a previous session we talked about, make sure you're communicating with your staff as frequently as you're communicating with your patients. Check in with them. Do one-on-one meetings if need be. Have more team meetings. Make sure everyone's on the same page. And again, don't overlook emotional needs. Think for a moment and respond in your head of how was that first wave in your area? Did it hit really hard? Were you one of those healthcare workers that was extremely stressed because of how your area was hit? How did you deal with that stress? Did you have ways to manage that stress? Did anyone help you out with that? Or were you someone helping your own employees or your coworkers out with these things? This is a fantastic thing to take into consideration as you plan ahead. Get those employees involved in developing this plan. Leah, I think you'd agree with me here. This should, developing this plan, this long-term plan, shouldn't be a one person's going to do it. It should be a full team effort, right?
Oh yeah, I mean, absolutely. I think, and I think we talk even a little bit more too about making sure people kind of understand the circumstances of the business and how things look in different scenarios, and all these things, so that people really feel informed, invested, part of the process. The more you can do that, I think the better. Just to make people feel engaged and know that how they feel, what they think matters, that their ideas are important. All those kinds of things are really critical.
Yeah, I found that in the experiences that I've had in the past, when there isn't enough information being shared, that's when those rumors start. So address those rumors, avoid that toxic work environment, provide information to your staff so that they have, they know, what the plan is as a practice or as a clinic. You might do some different things to help boost morale, whether it's team activities or you have your lunch meetings together, you're spotlighting employees for their outstanding work during a day or during a week. If you have employees like that we've talked about that are working at home, make sure that you connect with those employees. Don't let them feel like they're being forgotten. This is a fantastic time again to help really solidify the bonds of your team. Because again, many of us are working with our teams a lot longer than we are with our own families. So it's really important to build those relationships. You might do things like some different team building things just to keep things fun, during the day or during the weekends or whatever it might be, whether it's, some different quizzes or, we've been doing some things here at Solution Reach where we've been posting photos of our pets or, childhood photos and having some fun interactive quizzes and things just to keep things light and fun. And to have a little bit of leisure that isn't based around what we're doing day in and day out at the practice. This is a good way to help. Imagine your workday. You're a rubber band. You're being stretched. This is a great way to kind of release some of the tension on that rubber band a little bit. One of the other big things is preparing your finances. Now, Leah, I know you touched a little bit on some of the financial side of this. I'd love for you to dive in here as well and share some of your thoughts from your experiences.
Yeah, so this is a challenging thing. I've worked at a community access hospital, integrated health system with a lot of different services. Like I mentioned earlier on, we obviously have groups in every specialty under the sun, from single provider practices all the way up to hospital health system size practices. Everybody has different feelings about how much information to share about your financial outlook. This is a time where you're really going to have to find a way to try to be as transparent as possible about how things are looking and what the future looks like. And the reason for that is that, it may be that in your current circumstances, you're able to bring your staff back. But if you're hit again and you experience a drop in revenue of a certain amount or for a certain period of time, that you won't have any choice but to let employees go. And it's better to look at all of those scenarios now and really talk people through what that looks like and talk about your strategies. How are you going to try to keep things going and not fall to that level? So they know it's something you're really working hard on. Talk about, have you applied for a line of credit? Are you applying for one of these, small business disaster relief loans? So, probably most of you are aware, we've already touched on this Paycheck Protection Program, but there is also a program through the Fed. There is another program through the SBA Disaster Loan Program. There are a lot of states and local communities that are doing programs, whether that is straight up grant funding or loan programs. There are also some nonprofit organizations that are doing some things. I mean, there's a lot of stuff out there. So you just need to kind of talk your staff through, what are all the things we're doing? Have we tried applying for these loans and what were the results? Have we tried applying for a line of credit and what was the result? What are some of the cost cutting measures we might be implementing now? Or, what is our strategy to try to boost revenue? Just be really as transparent as you can be. And if you are uncomfortable providing really specific, details of your financials, that's okay. Just, do your best to try to be as transparent as you reasonably can be. And, be ready to apply for these programs as they come about. So, the money is moving pretty fast. As new programs become available, you're going to want to sort of be ready with everything that you need to be able to do those applications. So, might not hurt to, if you haven't done it already, develop a relationship with someone at your bank, if they're one of the banks that's doing lending for these kinds of programs. Have all of the documentation ready to go, and really closely monitor what's happening as far as different programs available. The SBA actually has been pretty good about putting information up on their website about different programs and what's available. Again, the ADA is a good resource as well for for that kind of thing. We do know right now that some of the larger organizations that took funding in the initial round of the PPP are giving that money back. So there may even be additional resources available. The new Paycheck Protection Program funding was signed, just signed the last couple of days, and that money is now available. Again, there are different, grant programs, loan programs, all these things. So really stay up on what's going on there. And then, this is moving forward. We're going to have some issues around just trying to be competitive in the market here. So Addison, do you want to talk a little bit about some of that?
Yes, these bullet items are often things that get pushed to the back burner because we are so slammed in our day-to-day at the practice. Many of us we understand the importance of having a website or having social media presence. We may have heard things like SEO and PPC, but we may not know what those mean or how they can really affect us. Again, this is a fantastic time to start learning and researching a little bit, as far as what these things mean and how they can benefit your practice, and maybe even taking time to add these into the plan of how these different things are going to be managed. So whether you decide, hey, this is the day we're going to finally start up our Facebook page, or you know what, our website needs a refresh badly. Our staff photo, there's only 2 people that are still working at our practice that are in that photo. I see that all the time. That SEO, that's that search engine optimization. If a patient is searching online, how likely are they to find information that your practice is the place to go for their treatment? And PPC, that pay per click, that's getting into that ad space of getting a little bit of advertising into the digital realm online. And we have, I think on this next slide, we actually have a list of some of the people in our marketplace that are more versed in some of these areas than even we are, right, Leah?
Yeah, absolutely. So we're just kind of throwing up a snapshot of the marketplace here, but we do have solutions here that can help with online listings, with websites. DM Score does an analysis of kind of how you stand in your kind of competitive market, and make some recommendations for things like local marketing agency resources and things like that. There's some My Social Practice really helps with the social media piece. I mean, there's other stuff in here too that's great, patient education related or additional patient communication tools. Skip is a service that's helping with some of these loan resources and things like that. But in terms of talking about sort of thinking about how you'll continue to grow your business and make sure that you stay competitive, now is a good time to add that as part of your long-term plan. And if you don't have a resource already available, there are some available on the marketplace that we've already vetted for you.
Excellent. Yeah, and again,
I'm going to hand this one to.
Oh yeah, I can say on that last one, if you have any interest in those, you can go to that solutionreach.com/marketplace, or when we send out the copy of these slides, those are clickable links that you'll be able to click on and see more info about that. Sorry, Leah.
Yeah, no, absolutely. And I was going to say, this is really Addison's kind of wheelhouse here, talking about education and training. So we'll hand that back over to him.
For those of you that were on the webinar last week, we all know Leah's big thing is communicate. My big thing is learn. So this is a fantastic time. Get as much education and training as you can get your hands on, whether it's new technology you've implemented, like telehealth systems, or maybe you're starting to do that digital intake process or a digital payment method. Maybe it's different things regarding the billing codes and more knowledge you need to gain on telehealth as a whole, or if it's the government aid package requirements, just so you can be ready for some of those financial things you can apply for. Or maybe it's even things that are dependent on there in the practice, such as team management. How can I be a better team member or a better leader in the practice? Are there any best practices that other people in our situation are doing to be more efficient? Look for as many sources of education as you can, because the more that you can learn, the more that you can grow in this time period, you're going to be so much better prepared, down the road to thrive in the practice and to accommodate a situation like this should it happen again. This is one of my favorite things, is complete the SR Success Formula training. If you go to our community, which is community.solutionreach.com, and you're logged in, at the top of that screen, you're going to see an option to go to our university. And we've created some really in-depth content that talks about ways to reduce no-shows and cancellations in your practice, increase the amount of appointments, and increase the number of patients that you see. Now, again, this is all fantastic in the realm of, this helps increase revenue, but really one of the big other takeaways here is the more efficient that you're running at the practice, the more patients can be seen, and the more health care you can actually provide to them. So again, this is a fantastic way to get on the up and up with Solution Reach platform and product and other features that we provide. Now, we've talked a lot about all the different things you should keep in mind, all the different things you should all the different people you should take a look at and take care of. Don't forget your own well-being here. Right? It's like when you fly in an airplane, put on your own oxygen mask first before helping the person in the seat next to you. Take care of yourselves. And I really want to stress that. Many of us here at Solution Reach have realized that, man, we have, some unhealthy work habits potentially. We're workaholics, a lot of us, and we need to take time to manage stress, or to take care of our basic needs, or take care of our families, and access any help as needed that you might need. But be kind to yourself. This is a momentous occasion to do things that we've never done before. But that doesn't mean that we need to be sprinting in every aspect. Take a breath, take a breather. You can do this, and you'll get through it. Just make sure that you're not trying to. I think of it, to some of those marathon videos you see where you have people that are still running while they cross the finish line. You have those people that are, they're crawling on hands and knees just to cross the finish line. Take the rest that you need. Take the breathers when you need them. You're going to get through this, and we're going to be here to help you out to do it. But take into account your own well-being when it comes to this. Now,
don't die trying in this particular case.
Yeah.
I mean, there's enough stuff to be stressed about, and along those lines, we want to just let for those of you who've been on some of the previous webinars, we've been getting a lot of questions about, hey, I'm not sure I can, our staff is largely furloughed, or I'm part-time, and I don't know if I can handle all this on my own. So we have put together a paid service that people can access if you're needing some help from our excellent team to be able to get through this and have someone else maybe set up some of your messaging, check your sync with Solution Reach, make updates and changes to templates and content, help you put together some group messaging and newsletters. You can actually do a paid service for that, and we'll have our team help you. Like we did with the telehealth, I'm going to quickly just push out a survey to ask, let us know if you want somebody to follow up and tell you more about this, and we'll make sure that somebody does. So for those of you who really are like, I do need this extra help, and it's worth it to me to pay a little bit for that to make sure we can get up and running quickly, we'll have somebody follow up with you. And then we'll give it maybe another 10 or 15 seconds, and then we'll close that down and we'll wrap up here. Throw in any last couple questions you have, and we'll try to hit those as well. Also, we do have a survey at the end, which will allow you, again, to let us know if you'd like somebody to follow up. So if for some reason you can't put your response in the poll, or you just decide as you're exiting the webinar, yes, I do want somebody to follow up with me, or if you want somebody to follow up with you about other solutions that we didn't ask about. So I know we asked about telehealth and we asked about the comeback service, but if you'd like someone to reach out to walk you through some of those other things like SR Pay, SR Intake, SR Schedule, you can let us know in the exit survey as well. All right, so I'm going to close that up. Thank you so much. If you did say yes, we will have somebody follow up with you so that we can make sure you get the help that you need if you're needing a little bit of extra support there. And then we're kind of here at the end. I'm just going to throw out a couple of reminders. We've had several people ask about the recording and the slides and the resources that are available as part of the comeback plan. We will be sending you a follow-up email, so you will have access to the recording and the slides and those resources. You can also always go to solutionreach.com to our resources section, or solutionreach.com/COVID, and access a lot of the resources that are available to everyone right now. And there's links in there for newsletter templates and posters you can hang in your practice, all kinds of stuff. I do want to mention that we are planning to do another webinar in 2 weeks that is a follow-up to this comeback program where we're going to be answering everybody's questions. So as you exit, the survey is going to ask you if you have any additional questions. Feel free to throw them in there. We're going to be aggregating all the questions from all the webinars into a series of topics, and we will be shooting out an invitation for that webinar, and you're welcome to submit additional questions later or bring questions for live Q&A. It's really designed to be a way to continue to kind of answer questions and address stuff. And I have to say, if Addison seemed excited on this one, I am guessing, Addison, you're going to be double excited on that one because that is right up Addison's alley.
Yes, yeah, absolutely. I know we've been really excited to go through these and yeah, ask away. This is a great time to do it.
Yeah, for sure. And then if you need some additional support, like we said, for support questions, go to community.solutionreach.com or email us at community@solutionreach.com. If you're not currently a customer and you're interested in learning more about Solution Reach and you didn't say, hey, contact me, you can always email or call. The information is there on your screen. We're here to support you. We want to try to provide the resources that you need and help you with best practices, with technology. And again, you should be watching for another email to invite you to that Q&A webinar. Also, you'll notice in the survey it asks if there are other topics that we have not covered that you would like us to cover. We are trying to plan for additional content and webinars moving forward to meet your needs. So please let us know if there are other topics we can be talking about or sharing information on right now. So I think we've answered most of the questions as we've been going along, and we've answered the questions about, resources, webinars, recordings, all of that kind of stuff. Again, if there's anything else we can answer for you, please throw it into the survey or email us. And we hope that we'll see you on that next webinar where we'll be answering all of your questions. Thanks so much, Addison, for joining me today and doing this. I think this is great content for everyone. Yeah. And thank you, everyone, for joining us. Please stay safe out there and take care of yourselves, and we'll look forward to seeing you on our next webinar. Bye, everyone.